Good afternoon, ma'am. I am Jonathan Buikoy and I am your rad tech for today. And mga tanong ko kung sa imong patient language preference.
Bisaya, sir.
Sige, noted po, ma'am. Ang mga tanong ko, ma'am, for confirmation lang ma'am para ma-identify na kung ikaw ba ang patient. Yung mga middle name, age, and birthday.
Fulvio, sir. Then, 17 years old po po. August 2024.
Sige. Ma'am, mga tanong ko, ma'am, kung asa ang part na imong ipa-x-ray.
Service po, sir.
Sige, noted. Injury ba na, ma'am? Cause ba na sa injury or trauma ang imong sa wrist?
Yes po, sir.
Right or left ba na, ma'am? Ano
Right
saan siya?
po.
Right.
Right.
Sige, no? Then, tingabi na makag-surgery sa una, ma'am?
Wala po, sir.
Wala. Napaka-cancer sa una, ma'am?
Wala po, sir.
Nagpaligarilyo ba ka, ma'am?
Wala po, sir.
Wala. So, lagi na ba kag-heart attack sa una?
Wala, sir.
Then, pregnant ba ka, ma'am? Karon?
No, sir.
Kano sa yung last nga gidugo ka, ma'am?
Last week lang po, sir.
Last week, sige. So, ma'am, pangayon ko ang requisition form for confirmation. Wrist man ni ma'am, no? Right wrist. So, na-injure niya siya, ma'am, kay na, ang sakit ko natukod.
Natukod, sir.
Pero maliyok pa rin yung wrist, pero ma'am.
Yes.
Sige. So, before ta mag-undergo sa atong procedure, ma'am, exact na kadaan, ma'am, na ang na dito ato ang dressing room, and sa dressing room na to, ma'am, na dito atong patient gown na ka-hanger, and ang pagsuot sa patient gown, ma'am, is naka sa likod ang pag-ikot. Then, maganda ko dahil, ma'am, natanggalon na to tanan na itong mga singsing or any metallic objects na nasa itong pag okay, ma'am. Sige. While our patient is nagsuot pa sa iyang patient gown, ang kailangan nato nga cassette or IR is 10 by 12 inches or 20 by or 24 by 20 centimeter. Our lead marker, which is right, kay right pan ang ano sa patient, right hand ang iyang wrist di ay ang natuan. Tapos naapod tayo lap shields. Muna ito ang ibutang sa lap sa patient, and our thyroid shield. So, ready na ba ka, ma'am?
Yes, sir.
Okay, so, before ta mag-undergo sa atong procedure, ma'am, mag-introduce ko sa inyo og thyroid shield, ma'am. So, ang thyroid shield, ma'am, kaya butang natin sa imong liog, then i-protect niya ang imong thyroid sa radiation, which is, ang thyroid mo, ma'am, is sensitive siya sa radiation. So, mag-out ko, ma'am, ha? Gulit ko, ma'am. Okay. Then, naapagay, ibutang na lap shield, ma'am. Muna ito ang atong shielding sa imong butang nato sa imong lap para maprotektahan imong gonads kanang ovaries kay sensitive po na siya sa radiation. So, ma'am, since ready naman ka, ma'am, diretso na ta diri, ma'am. Then, lingkod naman, pamino dyan sa akong instruction, ma'am, ha, para madali lang po. In today's demonstration, we're going to demonstrate the wrist routine procedures. So first is we need to demonstrate the PA wrist projection. So in PA wrist projection, the cassette that we're going to use is 8 by 10 inches, which is naka-portrait siya, and non-grid. Then in patient positioning, the patient must be seated. So as you can see, our patient is in a seated position, and position the wrist of the patient centered to the image receptor. Centered. Make sure that you center the wrist of the patient in the image receptor. along the hand and wrist parallel to the edge of the IR. Lower the shoulder and rest the arms on the table to ensure no rotation of the wrist. Hand pronated, fingers flexed, and hand arched slightly to place the wrist in direct contact with the surface. So, naka-arch siya. Ma'am, gamay imong kamot ma'am para ma-straighten ni imong wrist. Then, the next one is, the central ray must be centered at the mid-carpals. So, ang mid-carpals na to is naka siya diri. So, our central ray must be centered here, the mid-carpals. Then, the SID that we're going to use is 40 inches or 102 centimeter. Then, in collimation, collimate the wrist on 4 sides, including the distal radius and ulna and the mid-carpal area. So, to demonstrate the central ray must be centered at the mid carpals. So make sure that the patient in collimation, make sure that the wrist on 4 sides, including the distal radius and ulna and the mid metacarpal area, are included in the procedure. So, and do not forget to put the lead marker, which is right, and make sure that the lead marker must be not superimposed with the anatomy demonstrated. As you can see that the patient collimation is at, so ma'am, ayaw lihok ma'am ha, then shoot. In the resultant image of PA wrist projection, the anatomy demonstrated are the following: the trapezoid, the trapezium, capitate, scaphoid, hamate, pisiform, trichotrum, lunate, ulnar styloid, radial styloid, radius, and ulna are clearly demonstrated on the radiograph. So, in criteria evaluation, the scaphoid fat stripe is demonstrated, as you can see on the radiograph, the resultant radiograph. There is a scaphoid fat stripe is demonstrated. So to demonstrate this one, you need to have a correct set of technical data or technical factors. The ulnar styloid is in profile medially. As you can see that our ulnar styloid is in profile laterally. So to demonstrate this one, in related positioning, the distal forearm are rested and pronated hands against the IR in the PA projection. Then there is a superimposition of the mid-carpal bases is limited. So there is a limited metacarpal basis superimposition, which is visible when the wrist is centered on the IR. The next one is the radius scaphoid and radiolunate joints are closed. As you can see, these are closed. Then, the anterior and posterior margin of the distal radius are within the 0.25 inch or 0.6 centimeter of each other. The second through fifth metacarpal joint spaces are open. The scaphoid is only slightly foreshortened. The lunate is trapezoidal in shape. As you can see, the lunate is trapezoidal in shape. Then the long axis of the third MCP and the mid forearm are aligned. Lunate is positioned distal to the radio-ulnar articulation. As you can see, the lunate is distal to the radio-ulnar articulation. Then the carpal bones are at the center of the exposure field. The carpal bones, 1/4 of the distal ulnar and radius, and half of the proximal metacarpals are included within the exposure field. The next procedure that we're going to demonstrate is the lateral raise. So in lateral raise, the cassette that we're going to use, or the image receptor, is 18 by 24 centimeter or 8 by 10 inches, which is naka-portrait. Then there should be a non-grid for this one, tabletop, then lead masking with multiple exposures on the same IR. So in patient positioning, position the patient seated and arm on the table and elbow flexed, shoulder drop to place the humerus, forearm and wrist on the same horizontal plane, and remember to shield the patient. Put shieldings on the patient's lap. So, ma'am, mag-instruct ko ma'am, gunit ko ma'am ha, butang na to atong wrist diri ma'am. Ito nga, nakalateral ma'am. Right man ni ma'am, no?
Yes.
Center, make sure that the wrist joints are centered in the IR. Then, align the hands and wrist parallel to the edge of the IR. Then place the hand and wrist into true lateral position. Ma'am, pakiana ma'am, sunduga ma'am, ana. Then dirila siya ma'am, ang imong tan. State none. Then, the central ray must be perpendicular or must be centered to the mid-carpals. So, the mid-carpals are here. These are the mid-carpals. So, ma'am, dito ma'am. State ang kamot, ma'am. Then, the SID that we're going to use is 40 inches or 102 centimeter. In collimation, collimate to raise on 4 sides, including the distal radius and ulna and the mid-metacarpal area. So, to demonstrate the central ray, as I said a while ago, that the central ray must be centered at the mid-carpals. As you can see, the central ray is centered at the mid-carpals of the patient. Then do not forget to put your markers here at the exposure field. So, make sure that the lead marker must not be superimposed with the patient's anatomy being them. So, instruct the patient na dili na lihok or other necessary nga movements. Ma'am, ayog lihok ma'am ha, stay lang. Takiana sa imong thumb, ma'am. So, then, shoot. So, this is the resultant image of lateral wrist projection. So, in lateral wrist projection, the anatomy demonstrated are the first metacarpals must be clearly demonstrated, trapezium, distal scaphoid, pisiform, radius, capitate, lunate, and ulnar styloid. As you can see that the the second, third, fourth, fifth are superimposed to each other, no? It's like the first, second, third, fourth is superimposed to each other, while the fifth metacarpal is slightly superimposed with the others. So in anatomy demonstrated, pronator fat stripe is demonstrated, ulnar styloid is demonstrated in profile posteriorly, as you can see on the radiograph. The anterior aspect of the distal scaphoid and pisiform are aligned. Distal radius and ulna are superimposed. Distal aspect of the distal scaphoid and pisiform are aligned. Second through fifth metacarpals are placed at a 10 to 15 degree angle with the anterior plane of the wrist. Thumb is parallel with the forearm. Trapezium is demonstrated with a superimposition of the first proximal metacarpals. First, metacarpal is demonstrated without foreshortening. Carpal bones are at the center of the exposure field. The carpal bones are 1/4 of the distal ulna and radius, and half of the proximal metacarpals are included within the exposure field. Ma'am, ang procedure na to karon ma'am is humana na po. So, na dito atong dressing room ma'am, pwede na ka mag-release ma'am. And pakibalik lang po hanger sa patient gown ma'am ha. And the result ma'am will be 2 to 3 hours pa bago nyo makuha ma'am ha. Okay lang ba na ma'am?
Yes, sir. Okay.
Sige, thank you po ma'am.